The COVID-19 pandemic has affected all individuals in one way or another. It has brought stress, anxiety, and fear. But did you know that mortality and mental health rates are correlated to a person's income and ethnic background? As college students, it is important to realize and be informed about the inequalities that different people in our community face. The pandemic has had a great impact on people who are of lower social class and who belong to minority groups. Having taken community health classes with UNMC, living in a lower household income, and being part of the Latino community, I am eager to share with you the impacts of COVID-19 across different social groups. The pandemic has put Native American families and lower income families at higher risk of both contracting and experiencing more severe symptoms of COVID than their counterparts. On to my first point. Native Americans are disadvantaged when it comes to infectious diseases in their communities. Three major procedures that people have to follow in order to prevent an infectious disease, as you all may know, is to wear a mask, sanitize, and social distance, especially if someone is having symptoms. However, Native Americans suffer from poor housing, and they often lack efficient plumbing and space. High rates of unemployment and limited help from the government affects their financial situations. According to Norm Mabey, a reporter for a local newspaper in Minnesota, Native Americans have larger families and smaller homes due to the lack of affordable housing. Imagine if a family contracted the disease. Everyone in the family would be at a much larger risk of also contracting the disease. Quarantining and social distancing within the family can be very difficult in these households. The inadequate plumbing in these houses makes disease spread even faster. Another factor that has left Native Americans at a disadvantage are the pre-existing conditions that they already have to deal with. According to the Department of Human Health Services, Native Americans are more likely to already suffer from chronic diseases like diabetes and lung disorders. People who are severely sick from COVID-19 are likely to be put in a ventilator because it is a disease that attacks the lungs. Now that we have looked at the impacts of the pandemic on Native Americans, let's see how it has impacted people of lower socioeconomic status. The social disadvantages that people of lower class encountered during the pandemic caused increased levels of stress and fear. The jobs that people of lower income hold are more likely to put them at a risk of the virus and of unemployment. According to the U.S. Bureau of Labor Statistics, people with a lower education and lower income are more likely to only have the option to work at their workplaces. For example, you can't really bring a manufacturing plant or a fast food cashier position to your home. These jobs typically involve some sort of intensive physical and unskilled labor. People of higher class and education were able to work from their home and reduce the risk of being exposed and losing their jobs when things first started to shut down. Like Native Americans, people of lower socioeconomic status also tend to have pre-existing conditions that make COVID a lot more fatal. Maria Hernandez from the Department of Educational Psychology at Ball State University states that people in poverty suffer from illnesses that are associated with high mortality, such as diabetes, heart disease, and pulmonary issues. Therefore, a higher presence of COVID-19 within this population could be particularly disastrous in terms of mortality. The decreased affordability of healthy food for these individuals makes it easier for people to develop diabetes. To wrap up, we have learned that people who belong to minority groups and lower socioeconomic communities have been hit hard by the effects of the global pandemic. Housing, health, and employment conditions have all been factors that has flipped the lives of these people upside down. Consider the ways in which the pandemic has impacted your lives. Don't take greater resources and opportunities that some people receive for granted, and realize that every one of you holds a civil responsibility in attempting to stop the pandemic and the suffering of many people by wearing a mask. Thank you.